new paradigm for emergency response. 3 services readily available for every emergency: police, fire, and Care 7. It works. It works because of its structure, a steering committee, decision makers who can make things happen. Critical success factors, those few key areas where things must go right.
The need is so great and the problems so common. Emergencies happen everywhere, leaving people vulnerable. Every day in thousands of communities across the country, services like those provided by Care 7 are critically needed. Police officers and firefighters and social workers have known for years that there must be an alternative way to extend care and support. Consistency and trust in professional response builds confidence in positive outcomes and in everyone concerned.
Susan Schwab.
I'm curious about the implications of this kind of approach for a more massive scale crisis. Obviously, the implications for, say, the broader conversation about Homeland Security. How would that work in terms of the scale of the activities?
I think that it has a huge positive implication for Homeland Security, and we have talked about that in our community disaster response exercises. Care 7 is a critical component of our overall emergency management system. With the some 50 volunteers plus the paid staff that we have, that begins to give us a working point in which to address large-scale situations, and all of those people are available by pager, and we're beginning to develop the components of a network with other Valley communities who have started systems similar to Care 7.
Yeah, Kathleen Kennedy.
I had 2 questions. First of all, I saw that you had a volunteer as part of this program.
That's correct.
And I was wondering what their role was and why that was needed. And 2, I was wondering, do you always need, I think there's a health worker that's supposed to come at each of the emergencies. That was my understanding from reading it. And why do you need, why do you need that at every emergency? I didn't know if there was a replication somehow, but obviously I think it was helpful, so I was wondering on both those counts.
As to the question regarding the volunteer, Care 7 is a mobile unit, an 8-passenger van with a team of 2 people, one of whom is a mental health professional. The other person is a volunteer. It is essential that 2 people respond to the emergency. Often, more often than not, there are multiple parties involved, either directly or indirectly, in critical incidents. For example, family members who have witnessed their loved one have a heart attack, accidents, etc. So the 2 individuals work as a team in any situation, operating out of a fire station, responding immediately through the emergency service system. You mentioned duplication of effort. I think in some communities there are slices of what Care 7 does. Victim assistance programs, public mental health programs, but nowhere to our knowledge is there an integrated response with emergency services for the broad brush of critical situations that communities encounter: suicides, accidents, domestic violence, mental health issues, homelessness. There are quite a few things that Care 7 will respond to, and it is directly through the emergency service system.
Well, let me just ask, does every emergency get Care 7, or only those emergencies that it's clear that you need the mental health component?
Every emergency does not get Care 7. Key point. At times, Care 7 is dispatched with the initial responding units if the incident taker in the communications center determines that this is a priority call in terms of life and death and simply stress for the people involved. But in terms of going on every call, absolutely not. We would need a lot more Care 7 units just day to day. In terms of the volunteer issue that you addressed, I think one of the reasons for volunteers is to bring in people that represent the cross-section of the community in helping to extend support to others. And obviously, for us, it has been a very cost-effective way to implement this service at a reduced cost.
Bill Klinger?
The usual time that the team would be involved in any particular circumstance. In other words, you come in, you deal with a situation immediately as you're faced with it. Is there then a point at which you turn over the case, if you will, to other agencies of the government, or does the same team sort of carry through with the event?
The average time on scene, this is an average, is approximately 1 hour. And it would certainly depend on the nature of the circumstance as to the length of the call for service. But the great thing about Care 7 is there's an immediate link to community agencies that serve people who Care 7 responds to, be it grief issues, be it domestic violence, be it sexual assault, so that there's an immediate link following the response. After an hour on scene, an hour and a half on scene, the Care 7 workers can then give the family members the resources to connect with.
So there's immediate follow-up.
Immediate follow-up. And then as well, the next day, the Care 7 staff will phone the family and ask if there are any unanswered questions, did they need any further assistance, et cetera. So it's really a full wraparound safety net sort of service.
Elizabeth Shore, then Susan Golding.
Two questions. One is when you talk about that you make a decision about which calls need a Care 7 response. Do you find, was that a struggle to figure out how to make that decision? Have you gotten better at it? Do you find you're making mainly appropriate decisions about which ones should get the response? And my second question is, you put a lot of emphasis on the fact that the fire and police people really respect these additions to their team. Was that as a result, that seems to me the people who provide the sort of hard services very often have very little respect for the people who provide the soft services. Was that a matter of training? How have you dealt with that?
I think in terms of your first question, in terms of establishing the correct response for an incident, that actually comes very easily to our communication operators because they sense that over the phone. In a fire situation, for example, if there's people reported to be trapped in the house, then Care 7 is made a part of the initial response as opposed to a follow-up response. And that way there's someone there to deal with family members while rescues are being made and that type of thing. In terms of the other question, I'll turn that to Judy.
In terms of the respect, that's a really interesting question, and what we've realized and seen time and again is the building of trust in the competency for Care 7 services. And I might also add that from the mental health professional side, there's been an additional respect for law enforcement and fire personnel as well. So it's a mutual understanding, parity on scene, a real respect for the multidisciplinary approach and the appropriate place for each of those. So that's been a real rewarding part to see the gaining trust and respect from fire and police personnel and vice versa, from Care 7 team to them.
Susan
I think
Golding.
for fire personnel, as an example, there was virtually an immediate acceptance because the stress level on firefighters and police officers is so high in knowing that there's something more that needs to be done and they're not trained to do it. And the fact that that service was provided is probably the most universally well-accepted program that's been introduced into our fire services.
Susan?
Let me ask this question. Before Care 7, if you could contrast briefly what occurred before, I mean, did some of these individuals that did receive Care 7, did they have access to mental health services before, or did they not? I mean, what is really, other than the immediacy, which is clearly an innovation from reading your report, what occurred beforehand that has changed?
I think it's more than immediacy. I think
Okay.
it's the fact that there's actually intervention as opposed to people having to go and seek
Okay.
assistance. I think that's a primary paradigm shift, if you will. It's being brought to them. My experience is that from the mental health standpoint, in terms of emergency scene stress, most people don't know they need help.
And they may very well not know where to get it.
If you're held up at gunpoint, would Care 7 be dispatched to you?
Yes, definitely so.
In terms of replication, City of Phoenix, is it likely to embrace this program? And if so, why not? If not, why not?
Do you want this one?
City of Phoenix has a somewhat similar program. I think the difference for them is that the program in Phoenix is delivered from a fire services point of view only, and it does not have the collaborative working relationship of social service, professional oversight, and police department like we do in Tempe. I think that's a strategic difference in terms of us and the Phoenix program.
I think the other.
But they are doing something similar.
Or how many other cities are doing something similar?
There are 3 neighboring cities that have begun to emulate the Care 7 program. I wanted to add, in terms of Phoenix, the other difference is that they rely solely on volunteers for their program. We realized that when we began to use mental health professionals paired with volunteers, that began that really high level of competency and gained the respect and utilization expanded significantly when we instituted that pairing. But there are 3 communities that have emulated this program so far.
Ed Dorn, and then back to Susan.
Real quickly, did you confront any particularly novel legal issues when you began injecting an additional party, and particularly a volunteer, into a crisis situation?
We have not encountered any legal problems whatsoever. In fact, you know, the program, which is evaluated at each scene, we leave an evaluation card, and overwhelmingly people are very appreciative of the support that the program brings to them. And to date, touch wood, we haven't had any negative ramifications whatsoever. We have had people ask for incident reports, calls for service, but we're not inclined to give those over unless they're to the very person who was involved in the incident.
Susan?
The people who go out as part of Care 7, would those individuals also have likely seen the person who they're servicing as part of Care 7, but just not as immediately? The same number of resources would have been used, or is, in fact, what has happened is that more people are using the services, the cost is more, or is it the opposite? I mean, basically you've assembled the services and created an immediacy, which is very important to anyone who's, you know, gone through a trauma. Is it the same degree of service, or is it different?
Oh, I think the service is much greater.
Okay.
There's an immediate service on scene that's important in terms of recovering, if you will, from the terror of whatever incident may have occurred. And then additionally, there's the link to the community service that's offered. And in many communities, those services can tend to turn over based on soft monies, et cetera. But the community agencies are finding that there are far more referrals to them through this program, and the link is immediate.
But how has that changed the use of resources? You know, is it costing more because more resources are being used, or is it a rearrangement of resources?
I would say it's a rearrangement.
It's a rearrangement of resources because less resources are needed later because the intervention is early.
And do you know that through some evaluation or study? I'm just curious. I think it's a great program.
I think practically speaking, we do know that in some cases where fire service and police service have repeat callers. In any community, there are people who tend to call repeatedly for one reason or another. And we are able to intervene in those situations link those people to care for example, an 87-year-old woman who wants to live independently may not be aware of the services that are available to her in the community to be able to do that. So once she's linked, she's not going to be calling 911 any
And
longer.
she wouldn't have been linked previously? That's what I'm trying to understand.
Most likely, she would not have.
She would not
My
have been.
sense of it is that most people seen by Care 7 would never receive any support because people wouldn't be aware of the incident, for one, and because these people would not be knowledgeable that, one, they needed help, or two, if they knew they needed help, where to get it, or three, a concern about affordability and that type of thing. So I think the paradigm shift of bringing the service to them rather than waiting for someone to attempt to access the service is what makes the program so successful and helps so many people.
Thank you, and congratulations, Judy Tapscott and Cliff Jones. Thank you for coming here from
Thank
Tempe.
you.
Thank you very much.